It's that time of year, cold and flu season, temperatures are dropping and people are getting sicker. We're here with CBS News Chief Medical Correspondent Dr. Jon LaPook. So first off, the most common question, what's the difference between a cold and flu? How could I tell?
If you've ever had the flu, there is no mistaking the two. I mean, there can be overlapping symptoms. So you can have cold symptoms are generally from the neck up. You have a sore throat, a runny nose, congestion, you can have a little bit of a cough. If you have the flu, you can have all that stuff, but in addition, you are sick as a dog. You have a fever, aches and pains. You feel like you're hit by a truck. And you can have complications from that. It can lead to pneumonia and even death, especially in the elderly. Most of the deaths that we see each year are in people who are over the age of 65 and also in the very young, under the age of 2.
So you would know then if you have the flu?
Well, you might not, but it's not like a big banner goes in front of you and you can't miss it. You can have sort of mild symptoms at first. But if you have any questions about it, if you have that systemic kind of feeling, talk to your doctor. And one of the reasons why you should do that is that there are medications, antiviral medications like Relenza and Tamiflu, that if you take them within the first 48 hours, you can prevent some of the difficult sequelae of the flu, and you can shorten it.
So I start feeling symptoms. I got the nasty head cold and I'm in pain. What should I do? Should I call you immediately? Should I go to a drugstore and panic? What should I do?
Panicking is good. You want to panic first. That's the no. I'll tell you, the first thing that you don't want to do is demand antibiotics from your doctor. Viruses are not treatable by antibiotics. I'm going to say that again because every year I have to talk over and over again to patients about this. Viruses are not treatable by antibiotics. What can happen later on, say several days or a week after an initial viral infection, is you can get a secondary bacterial infection. It could go into a bacterial sinusitis or bacterial bronchitis, and at that point you may need to get some antibiotics. Antibiotics may help. But this rush to get antibiotics is really a problem because what it's done is led to antibiotic-resistant organisms like MRSA, these superbugs that are tough to treat.
Is there anything particularly concerning about this year's strain of flu compared to previous years?
Well, this year it seems like predominantly it's H1N1, which is the swine flu, now called PH1N1. The P stands for pandemic because it's the same strain that happened in 2009 with the big pandemic swine flu epidemic. A lot of people died. The old, over 65, the young, under 2, of course, are always susceptible, but especially with H1N1, this strain, the middle-aged, the younger people also tend to get it, and they can have a bad reaction to it. They can get very, very sick. It's all part of the reasons why the CDC is really urging everybody over the age of 6 months to get the flu vaccine, to get vaccinated, unless there's a really good reason. Some reasons are you're allergic to eggs, you've had a reaction to a previous vaccination attempt, but for the most part, everybody over the age of 6 months should get the flu vaccine unless there's a very good reason not to.
Helpful advice. Thank you so much, Dr. Jon LaPook.